Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Coagulase. Coagulase enzyme is of two types. We have tube coagulase and we have slide coagulase. Tube coagulase and slide coagulase are important. Tube coagulase is mainly because of coagulase enzyme, whereas slide coagulase is mainly due to the clumping factor. Tube coagulase will require coagulase reacting factor in the plasma. This is coagulase reacting factor in the plasma is important for tube coagulase, whereas slide coagulase does not require coagulase reacting factor in the plasma. Tube coagulase is mainly done in the tube, whereas slide coagulase is mainly done on the slide. Tube coagulase. This tube coagulase is positive. That means the coagulum is uh, formed. If tube coagulase is positive, that means a coagulum or plasma clot is formed. Whereas if slide coagulase is positive, it is done on the slide. So you will see formation of clumps are seen on the slide. Then tube coagulase positivity is shown by Staphylococcus clefairy and Staphylococcus lugdunensis shows negativity. So Staphylococcus lugdunensis is negative for tube coagulase, whereas Staphylococcus clefairy is positive for tube coagulase. Whereas in slide coagulase, Staphylococcus lugdunensis is positive for slide coagulase, whereas Staphylococcus clefairy is negative for slide coagulase. But there are other coagulase species which have both tube and slide coagulase positivity is. Both tube and slide coagulase positivity is seen in Staphylococcus hyosus and Staphylococcus intermedius. In Staphylococcus hyosus and Staphylococcus intermedius, you see both coagulase species, that is tube coagulase and slide coagulase, to be positive.
thank you and thank you for watching.